Welcome back, West Michigan. You're watching Alive and Well. I'm Lynda Balkema, and with me now is Dr. Kimberly Fenbert, who is a pediatric nurse practitioner with the Grand Valley Medical
Family Health Center.
Family Health Center. I think I blew that already. So, welcome back. You've helped us before with some information when we talked about little Matthew, about his ITP, and today we're talking about autism. We interviewed Shelby Denio and her mother Pamela Denio, and now you're going to give us some information from the medical perspective on autism. So, let's start with the diagnosis, or actually what autism is medically.
Okay. Well, autism is a brain developmental disorder that affects the language, behavioral, and social interaction. And it's a spectrum of diseases that can go from mild to more severe forms. The more mild forms are often in the range of Asperger's, and the more severe forms can be autism. It usually affects about 25 in 10,000 kids.
Okay.
So
that's interesting because we were questioning earlier about Asperger's, and I did do some reading. They are kind of connecting them together or grouping them together in a diagnosis. There's been some controversy recently in Muskegon Chronicle about that. But when they say a broad spectrum disorder, I guess that would cover a broad spectrum. Right. So Asperger's does present differently, correct?
Asperger's is usually the more mild part of it, and they do call it a spectrum of disorders. So you have Asperger's, you have Rett's, and there's another one called the pervasive developmental delays. Okay. And those are all part of that autistic spectrum. So
okay. Well, Pamela gave us some ideas about the first thing she experienced when they decided to take Shelby in to be tested, and they had actually seen a show on 60 Minutes and about autism, and she thought, wow, those are some of the things that my daughter exhibits. So what are some things that you would observe or see or ask about?
Okay. Some of the early warning signs of autism, they often have a decrease in eye contact. They also have a decreased interaction with other children. They often don't play with other children. They sometimes have some strange hand movement, like hand flapping, or they can often rock back and forth. They have some delayed language. Sometimes these children have normal language skills, and these language skills all of a sudden start to diminish. So they lose their normal language skills. They have really bad temper tantrums, and often cannot handle a change in routine. Now, any one of those things can be very normal in a child. Yes. So just because your child has one of those behaviors, yes. Thank you, yes. Doesn't mean that your child has autism. But a combination of several of those behaviors sometimes can mean autism.
Yes. And in Shelby's case, she did have several of those. And again, no one child is going to have all of them, correct? But right. They could just exhibit some of those, and that's the spectrum. It's different for each one. It's, as Shelby's mother told us, autism is unique as the person. It's unique to each individual. What are some of the treatment options that they do?
Some of the treatments actually would be, well, can I step back a minute and kind of talk about how we diagnose that? Okay. And actually, we've really gotten more proactive with our diagnosing. As a provider, we actually start looking for these behaviors at 18 months, and again at 24 months. Because in our research, we have found that if we can diagnose these children at an earlier age, we have found out their outcomes are much more positive. So that is one thing that we do. And some of the treatment options would be to get these children into physical therapy, occupational therapy, behavioral therapy, and kind of taking that step back again. Diagnosing these children can take months. It takes a combination of us looking at the children, taking information from their parents. They often are set up with a psychologist and also with a pediatric neurologist. So it is a long process of really being able to figure out what these children have. It can be very frustrating to a parent. So other therapies that we do, sometimes some of the studies also have shown that changing a diet, we have found that casein in a diet, which is found in dairy and dairy products. Also gluten, if you take gluten out of a diet, which is wheat, rye, and barley, sometimes that has been found to be helpful. Those are kind of in the studies. It doesn't help all children. Also, just plain having a good, healthy diet is very important. Some studies are showing that having vitamin B, omega-3, fatty acids, that's not for every child. So it's very important to work with your healthcare provider on what's right for your child. But those are some of the
Well, I have to tell you, Shelby needs to meet you because Shelby wants to be a nutritionist, and I believe Shelby could become a nutritionist, and she would probably just relish all that information you just gave about the different diets. I myself have been trying a gluten-free diet, and that's a very difficult diet. Gluten's in everything, but they're linking it to so many things now. It's amazing. So, well, another thing that I want to touch on is tactile, the touch. Pamela told us that with Shelby, she used to brush her legs with a brush just to get her used to touch again. And some of the things that these children, they don't attach to moms the way other children normally attach. And so they don't have that fear of strangers, and they could just walk off with anyone. They don't fear when mom leaves the room. They don't understand emotions and feelings the same as we do. Right. So you have to literally explain those emotions to them. Right. What are some other information that you have for us medically on autism? I know there's a lot of new discoveries being made. One of the things I should ask is some of the allegations that have been made in the past, they've thought possibly, immunizations and things could be linked to that.
I'm glad you brought that up. I really want to stress to all parents, they have absolutely found that immunizations are not linked to any sort of autism. At one point, they thought it was a preservative that was found or was put in immunization, which was called thimerosal, was linked to autism. And they took the thimerosal out, and we still are having autism. So that has absolutely been ruled out. So I want to stress to parents, please, please have your child immunized. Children should be immunized at the correct schedule, on time, all the immunizations. It's very safe, and it is not linked to autism. So I feel that's very important, and absolutely it is not linked to autism. I think probably the biggest cause that I'm seeing in the research right now, it looks like it's being related genetically, but they just don't know at this point.
So when you say genetically, is it possibly passed down? Because we talked in the Denio family and in other families I know, none of the other children show any signs of this. So would that be skipped a generation, or genetically?
Genetically, it looks like maybe on the chromosomes there might be like a little addition or a little deletion on a gene, and that's still being researched. Okay. So
well, that's interesting.
What it looks like.
Okay.
Yeah.
Well, thank you so much for coming back and joining us again. Is there any other final information that you'd like to share on autism?
I think, the other thing I would just like to say as far as advice, make sure as parents that you're getting all your well child checks, immunize your children, talk to your health care provider about any kind of concerns that you have, and just remember that, all these symptoms do not mean that your child has autism, but bring up any concerns that you do have. And also, if your child does have autism, try to hook up with a support group. That's so important because a child with autism, you need support. It's very important. As far as educators and peers, not all autistic children are alike, and it's very important to talk to parents, find out these children, what their personalities are, what they need. Some have tactile issues, some do not. Some are very high functioning, some are not, and they shouldn't all be treated the same. They're wonderful children, but they all do need to be treated very individually, and that's really about it.
And I want to reiterate something that Pamela told us that's so important. Doctors, of course, are wonderful, and we're so lucky to have them, but you also know your child. And when you're told your child can't read, don't just take that at face value. They worked with Shelby. She reads at a college level, and she's a sophomore. So there's all kinds of possibilities. And never lose hope. Don't give up. As a family unit, work together because it affects the whole family. So I thank you so much. This has been such a great story, and I've so enjoyed Shelby and her mom and all of that we've learned about autism, and we have a lot more to learn. So stay tuned, keep watching Alive and Well, and we'll keep you tuned in.